Public Hospital. Iskenderun, pearl of the Mediterranean, which has the feature being the biggest county of Turkey, breaks grounds on fields of tourism, industry, sports and health. Iskenderun, having almost 1.5 million people, is a modern city that develops day to day and follows developments closely. Because of this rapid population growth and development, all official and private institutions follows these developments closely and meet the requirements. In this enormous structuring, Iskenderun Public Hospital is the biggest hospital of East Mediterranean region and therefore it has the biggest importance unquestionably. Iskenderun Public Hospital started to provide services in 1927 in the first building of surgery and chest diseases. The hospital that provided services in that building for many years was settled in the old SSK Hospitals building in 2006 after combining the hospitals by the Ministry of Health. In 2011, the new building of hospital, whose construction was made in Iskenderun Numune Quarter, which has 250 inpatient bed capacity, that is the biggest hospital of the region, started to provide services. In November of 2011, the process of moving Iskenderun Maternity Hospital and Nursery to a new building was completed, and so Iskenderun Public Hospital continues to provide services with 535 inpatient bed capacity in total. In Iskenderun Public Hospital, 1,003 personnel, professional administration staff, 132 specialist physicians, 25 practicing physicians, 9 pharmacists, 2 dietitians, 5 psychologists, 11 physiotherapists, 4 social service specialists, 2 biologists, 262 nurses, 106 midwives, 35 health officers, 4 emergency medical technicians, 50 laboratory technicians, 38 X-ray technicians, 30 anesthetists, and 156 general administrative services and complementary services and technical services officers provide services in Ayvalık and in the new building. Furthermore, 649 personnel provide services in fields of data processing, cleaning, security and food in Iskenderun Public Hospital. Polyclinics. For purpose of providing the best services for the public, the 102 polyclinics in total in 27 different branches in Ayvalık and the new building of Iskenderun Public Hospital. The hospital that works with mission, health comes first as a complete medical equipment and expert staff. Emergency service. In consideration of population density of the region, the emergency service of the hospital is capable to meet all requirements. The general emergency service in Ayvalık mostly provides services for adult patients, and the emergency service in the new building mostly provides services for children and maternity patients. The emergency service in the charge of 2 emergency medicine specialists has completed the preparations for the level 3, which has the highest level criteria. Operating room and emergency tomography is available in emergency service of the new building, which has been completed recently. There is integrated 112 emergency service station belonging to Hatay Province Health Directorate in emergency service of the new building, which has also an intensive care unit and an elevator for reaching to the surgery room directly. Operating room. There are 20 operating rooms which have a technology for complicated operations in Iskenderun Public Hospital, which is the unique public hospital having laminar flow technology with HEPA filter. In the hospital, heavy and complicated operations such as aorta aneurysm, brain tumor, vertebral fracture, closed spinal fractures operations are made. In the operating room, safety-level sterilization is performed in the surgical operations in addition to the indicator following and tests in the central sterilization unit. Intensive care unit. The intensive care units have the most advanced technology and medical equipment. Our people are in safe hands of specialist physicians and expert staff. In parallel of the qualification and growth of capacity, number of university hospital referred patients is significantly decreased. There are 30 beds in the surgical intensive care unit, which has HEPA filter ventilation, 16 beds in the coronary intensive care unit, 10 beds in the newborn infants care unit, and 16 beds in the internal intensive care unit. In the intensive care units, where the certificated health personnel provides services, the preparations for level 3 intensive care, which has the highest level criteria. Clinic. Iskenderun Public Hospital has totally 535 inpatient bed capacity, consisting of single rooms and double rooms. There are central vacuum oxygen panels, BC bedroom-connected nurse calling system, positional sick beds with 4 motors, central air conditioning, refrigerators, and LCD TVs in the sick rooms. Furthermore, there are comfortable, openable armchairs and independent restroom for patients' attendants. Gynecology and delivery room. Obstetrics from the first days of pregnant are performed in the units, where the specialist physician staff and specialist midwives provide services. Rhythm and following of prenatal preparations is performed in safe and comfortable mediums. In the unit, where all services are provided for the children to born healthily, all observations and therapies are provided. Furthermore, there is independent operation room in the unit. Following the patients are realized by the single pain room and following room of postnatal. Hearing tests and calcaneal blood tests are performed for the newborn infants in the hospital. The hospital is also called as Mother-Friend Hospital and Baby-Friend Hospital through the services in these fields. Newborn unit. In this unit, a procedure of treatment with affectionate hands, which are not different from motherhood, is applied for babies who are newborn and who need for intensive care services. One of the most important units in this institution, that is also called as baby-friendly hospital, where the works are accelerated, is the newborn intensive care unit, where the emergency babies are accepted in. The first treatments are made and therapies are continued in the newborn intensive care unit. In the unit, there are 18 incubators in total. 15 are normal, 10 of them are in intensive care unit, 5 are in newborn service, and the other 3 incubators are ventilated transport incubators. Radiology. The patients are diagnosed by using advanced technologies such as magnetic resonance, computed tomography, mammography, scintigraphy, bone densitometry, Doppler USG, digital Röntgen, and IVP in the radiology unit that works with appointment system. Laboratory. The other place for diagnosis in the hospital is the laboratory, which has advanced technology. The tests and examinations asked by the specialist physicians are performed in the laboratory consisting of 3 divisions: biochemistry, microbiology, and pathology. Furthermore, tests of EKG, F4 EKG, Holter, echo, audiometer, endoscopy, EEG, EMG, bronchoscope, allergy, respiratory functions, and uroflowmeter are performed in the hospital. Psychiatry unit. One of the most developed psychiatry units of Turkey is in Iskenderun Public Hospital. There are sport implements for using in sportive activities and a field for garden works in the service. In the special days called as Joyful Wednesday, which are set once in 15 days, some social activities are prepared for the patients. Furthermore, personality tests, intelligence tests, emotion status tests, and specialist tests for children are performed by the psychologists in the service. Dialyzer unit. There is one dialyzer unit with capacity of 11 devices in total in the hospital. The patients are trained and made available to apply peritoneal dialyze in Iskenderun Public Hospital, which makes a move peritoneum dialyze that the patients can apply themselves without depending on any machine. Home health services. 2 physicians, one of them is specialist physician, take charge in home health services, which was recently started to be provided by the Ministry of Health. 422 patients have been provided with health services by the home health services from 2 separated mobiles until now. The services flow continues in parallel of applications. Blood Diseases Unit. Regular treatments and followings for the patients against Mediterranean anemia, which is the most important hereditary disease in this region, are performed in this unit. Couples preparing for marriage were tested medically and are made informed in this service in which a general practitioner works. Casework Unit. Patients are interviewed in the casework unit focused on psychological support and problems of the patients who have difficulty for hospital compliance are solved. The hospital staff is trained on patient psychology, empathic development, and stress methods. Furthermore, a kindergarten provides services for children of the hospital staff in charge of a social service specialist. Organ Donation Unit. Applications of people are accepted and recorded for organ donation. In 2011, organs of a patient whose brain death was realized were donated by his family, and so that his organs were ablated in Iskenderun Public Hospital, and those organs were transplanted to 4 persons. Stone Breaking Unit. The patients who are diagnosed that their kidneys are with stones are sent to unit and are treated securely with clinic seance applications. Physical Therapy Unit. All technological opportunities are available in the Physical Therapy Unit, which is designed properly for standards. Special therapy seances are applied for the patients by the physiotherapists. Training and seminar works were attached particular importance in order to increase capacity of information and knowledge of the personnel working in Iskenderun Public Hospital, which is a pioneering institution in the region where it provides services. There are 3 dining halls which has a capacity for servicing for all personnel in the hospital. There are 8 servers and dependent 600 computers in Iskenderun Public Hospital in order to keep the patient records regularly and securely. Via selection physician system of the Ministry of Health, people are allowed to be examined by doctors whom the patients select in the hospital. In 2011, Iskenderun Public Hospital were about 1,200,000 polyclinic examinations, 31 hospital patient treatments, 45,000 operations, and 320,000 emergency service examinations were performed, increases its service quality day to day. Iskenderun Public Hospital, the pioneering hospital of East Mediterranean region.